Good afternoon, and thank you for joining today's briefing on HIPAA hurdles, protecting patient data in the digital age. I'm Kent Iler, and today we're going to deep dive into what may be the most significant changes to healthcare cybersecurity requirements in over 2 decades. This presentation is specifically designed for healthcare managers, security officers, compliance officers, IT security leaders, everyone who needs to understand and prepare for the dramatic shifts coming to HIPAA compliance. So what we'll cover today isn't just theoretical. These changes will directly impact your budgets, your staffing, operational procedures starting in 2026. So before we begin, though, I want to emphasize the information we're discussing today represents proposed changes that are still under public comment and have not been approved yet. We're still waiting on that, but that's expected later this year. But given the current cybersecurity climate in healthcare, it's essential that we start preparing now. So let me give an overview real quick of our company, Iler Networking and Computing. And we're a managed services and security provider. This is our 31st year in business, and we're headquartered in Sheffield Village, Ohio, which is just west of Cleveland, Ohio. We also have branches in Iowa and South Carolina. And so we can be a fully managed IT provider for clients. That means we are the IT department. If a company is too small to have someone that's super dedicated for IT, our team can be that for you. But if you are a little bit larger and you even have an IT department, we can come in and help with co-manage. So we have assurance service plans that will fit your IT needs because every business is a little bit different and you're not cookie cutter where one shape fits all. So we'll come in, we'll do a free analysis and give you multiple options on how we can best provide solutions that will meet your cybersecurity and IT needs. We also offer compliance as a service. And today, as we're talking about HIPAA compliance, that's one of the things. If you don't have someone internally that's well-versed in what these HIPAA compliance requirements mean, we can come alongside you, partner with you, and make sure that you are able to meet all these requirements. We also do PCI requirements, FTC safeguards, NIST CSF. There's a lot of different ones that we do. So if you have different regulatory safeguards that you have to be compliant with, talk to us and we can help. And the last thing is all of our techs are CJIS certified. So CJIS is the Criminal Justice Information Systems. It's a certification that is required for anyone that handles law enforcement support. And we have multiple law enforcement agencies. So all of our techs have been background checked by the FBI, fingerprinted as well. And so you can be confident to know that the techs that are going to be working on your system and have access to your data have been vetted and are trustworthy. So the MSP Titans of the Industry Gala is an award that we received, and it was a red carpet event held in Beverly Hills, definitely outside my comfort zone. It was hosted at the iconic Beverly Hilton. That's the same venue where the Golden Globe Awards takes place, and the evening was truly unforgettable. The event featured appearances by Jay Leno, Magic Johnson, adding to the excitement and prestige of the night. So we were honored to be recognized as one of only 10 managed services providers globally named as finalists for excellence in one of the key markets that we support. And this recognition is a testament to the level of commitment, innovation, and service that we provide to all of our clients. Being selected at this level underscores the trust that our clients place in us and reflects our relentless pursuit of excellence in IT support, cybersecurity, and compliance. So let's walk through our agenda today. So we have 5 critical areas that I want to cover, and I've structured this to move forward from kind of the current crisis in healthcare cybersecurity to concrete actions that you can take immediately. So first, we'll examine the current threat landscape, and frankly, the numbers are staggering. We're going to then look at major breaches that have happened and really shaped the regulatory response. And next, we'll dive into HIPAA enforcement trends because understanding how OCR is prioritizing enforcement helps us to understand what's coming. The heart of our presentation focuses on the new proposed HIPAA security rule changes, and this is where you'll want to take detailed notes. And finally, we'll conclude with a practical implementation strategy and timeline. So each section is going to build on the previous one. So we'll see how the current crisis has driven regulatory response, which in turn demands immediate organization. Go through and answer any questions that you've got. At the top of your window, you should see a button with a question mark, and that's where you can go ahead and post questions now, and we'll go through and take care of those anytime or at the end of the presentation and make sure that all questions are answered. All right. So before we dive into the crisis and changes, let's ensure we're all talking the same language. As a techie, we have a lot of different acronyms that we use, and they're different ones. One thing that pops out here on this screen is OCR. That's commonly referred to as optical character recognition, which is when you scan a document and then change that document into text. In today's case, OCR is the Office for Civil Rights, which is the primary enforcement agency for HIPAA, responsible for investigating complaints, conducting audits, and imposing penalties for noncompliance. So if you look through here, you can see HIPAA is the Health Insurance Portability and Accountability Act. It remains the cornerstone of federal law, but its focus has dramatically shifted from the portability to protection in the digital age. So PHI and EPHI are distinctions that are becoming really increasingly important. While PHI covers all the individually identifiable health information, EPHI, or electronic PHI, is where the new rules are really focusing most heavily. So if your organization handles any electronic health data, these requirements will affect you. And we talked about OCR already. The distinction between a covered entity and business associates is crucial because the new rules expand requirements for both categories. If you're a business associate, you can no longer rely on your covered entity client to handle compliance. You will have direct obligations. And then we've got one more slide here for additional terms. So we'll hear us talk about the NPRM, which is the Notice of Proposed Rulemaking. That's one of the things we're discussing today. This is the formal process by which HHS is proposing regulatory changes. So the comment period for the current NPRM closed on March 7th. So there's it's already been closed, but it just lets you know that what this process is. And for future NPRMs, you have the ability to actually make public comments to there and give feedback. So when they make the decisions, your voice can be heard. So we talk about HHS, which is Health and Human Services. This encompasses multiple agencies, but for our purposes, OCR is the enforcement arm that we're going to focus on. The NIST cybersecurity framework has become the de facto standard for cybersecurity across industries, and the new HIPAA rules reference NIST extensively. If you're not familiar with NIST CSF, that's a gap that you should address. And one of the things here in Ohio, where we're headquartered out of, and we also have offices in Iowa, they are safe harbor states for any organization that is NIST CSF compliant. What that means is if you can prove that you are NIST CSF compliant, you have a data breach, then you are protected from the fines and fees that come typically associated with that breach, because it shows that you've done your due diligence, trying to take the steps to protect your organization and the data from a cybersecurity standpoint. You know, the FBI spends millions, the CIA spends millions on cybersecurity defense, and they still get hacked. So unfortunately, there's nothing we can do to get you 100% there, but we want to get you to 99.99 and several nines after that. HITRUST provides a healthcare specific framework that many organizations find helpful for comprehensive compliance. It's not required, but it's increasingly recognized kind of as a best practices approach. And then HIMSS services as a key resource for staying current on healthcare, IT trends, and compliance guidance. So we recommend that you stay in there. All right, so now let's look at why these regulatory changes are happening. The numbers of the slide should alarm every healthcare leader. So 725 large breaches were reported in 2024 alone. We're projecting an 11% increase in 2025. So to put this in perspective, that's nearly 2 major breaches every single day, affecting 500 or more individuals. But the more staggering statistic is the 950% increase in affected individuals that we saw between 2018 and 2023. This isn't just more breaches, it's exponentially larger breaches affecting more people. We're seeing breaches that affect millions of individuals in a single incident. The 264% increase in ransomware attacks, specifically targeting healthcare, shows that our industry has become the preferred target for cyber criminals. Why is this? Well, healthcare organizations often have weaker security controls, critical operational dependencies, and are more likely to pay ransoms to restore patient care. And these aren't just statistics. Each number represents patients whose most sensitive information has been compromised, healthcare operations disrupted, and massive financial losses across the industry. So back in February of 2024, the Change Healthcare attack, it represented really a watershed moment for the healthcare cybersecurity, and it's directly driving the regulatory changes that we're discussing today. 190 million individuals affected makes this not just the largest healthcare breach in history, but one of the largest data breaches of any kind ever recorded. To put this in perspective, that's more than half the US population. The nationwide disruption went far beyond data theft. Healthcare providers couldn't process claims, pharmacies couldn't fill prescriptions, and patient care was delayed across the country. This demonstrated how a single point of failure in our interconnected healthcare system could bring down operations nationwide. Massive financial losses, and we're talking billions across the healthcare systems, weren't just from the ransomware payment or recovery costs. Providers lost revenue, patients faced delays in care, and the ripple effect continued today. But perhaps most importantly, the breach highlighted our dangerous third-party dependency. Change Healthcare wasn't just processing its own data. It was a critical infrastructure provider for much of the U.S. healthcare systems. And the supply chain vulnerability is exactly what the new HIPAA rules are designed to address. The attack succeeded really through relatively basic social engineering and system misconfigurations, problems that new HIPAA requirements are specifically working on preventing. All right, the critical state of healthcare cybersecurity. I'm sorry, here we go. My slide came through just a little bit off here. So the Change Healthcare breach, it's not going to be an insulated incident. It's part of an accelerated pattern of sophisticated attacks on healthcare infrastructure. We're seeing the cyber criminals, the bad guys, really becoming more sophisticated in all the tools that they're using. The health equity breach affected 4.3 million individuals, and that demonstrates how business partners compromise can affect massive numbers of people. This wasn't even a direct attack on health equity. It came through a compromising business partner, which highlights the supply chain vulnerabilities that we talked about. So this represents really a fundamental shift in the threat landscape. In just the first half of 2025, supply chain attacks affected 79 entities and compromised over 78 million records. So we're seeing attackers specifically target service providers because they can affect multiple healthcare organizations simultaneously. The critical statistic here is 76.7% of monthly breaches are now attributed to hacking and IT incidents. This isn't accidental disclosures or lost laptops anymore. It's deliberate, sophisticated cybercrime targeting industry specifically. So understanding how these attacks succeed is crucial for understanding why the new HIPAA requirements focus where they do. Supply chain vulnerabilities have become the preferred attack vendor because they offer the highest return on investment for criminals. Why attack one hospital when you can attack their EHR vendor and affect hundreds of hospitals? And this is why the new rules significantly expand business associate requirements. Phishing campaigns targeting healthcare employers are becoming increasingly sophisticated. Attackers research specific employees. They understand organizational structures and craft emails that are extremely difficult to distinguish between legitimate communications. And the new MFA requirements are specifically designed to limit damage where these attacks succeed. System misconfigurations represent the easiest path for attackers. Unsecured databases, misconfigured cloud storage, and poor network segmentation provide very simple entry points. The new technical safeguard requirements are designed to help eliminate these easy targets. These aren't theoretical vulnerabilities. These are the exact techniques used in every major healthcare breach that we've analyzed. So OCR's response to this crisis has been swift and aggressive. So understanding their enforcement priorities helps us to really understand what's coming. The increased focus on security rule compliance represents a fundamental shift. So OCR used to focus primarily on privacy rule violations, unauthorized disclosures, inadequate patient access, and similar issues. But now they're actively pursuing security rule violations, particularly around risk analysis and these technical safeguards that need to be in place. Their new risk analysis enforcement initiative, it specifically targets organizations that can't demonstrate comprehensive risk analysis. So this isn't just checking a box anymore. OCR wants to see detailed asset inventories, threat identification, and vulnerability assessments. We're expecting record-setting enforcement activity in 2025. OCR has significantly increased their audit capabilities and is being much more aggressive in pursuing violations. The penalty structure also allows up to $2.18 million per violation category, with multiple violation categories possible in a single case. So we're seeing settlements that can reach tens of millions of dollars. This isn't just a compliance cost anymore. It's basically a business risk through there. So these recent settlements demonstrate that new enforcement reality and help us to understand kind of the financial risk of non-compliance. UCLA Health 7.5 million settlement stemmed from delayed breach reporting and inadequate security measures. The delayed reporting violations alone cost them millions. The new rules make reporting requirements even more stringent. And then the Montefiore Medical Center's 4.75 million penalty, that specifically focused on inadequate risk analysis and vulnerability management. So these are exactly the areas where the new rules are adding specific technology requirements. The settlements aren't just about the money. They include extensive corrective action plans that can take years to complete and cost additional millions in implementation costs. The key point I want to make here is these violations occurred under the current less stringent requirements. The new proposed rules raise the bar significantly higher, meaning future penalties are likely to be even more secure. So understanding the timeline here is crucial for your planning process. So December of last year, 2024, the NPRM was issued, and this is again the start for the formal regulatory process. Then in March 7th, 2025, that was when the comment period closed. So your organization would have needed to submit any comments, particularly if you had any concerns about implementation costs, technical feasibility, those types of things. Obviously, we're well past that. So next quarter in Q4 of 2025, we expect the final rule publication. So that's going to give us the definitive requirements and compliance timeline. So once that is approved, we're going to have some type of implementation window that's going to be 18 to 20 months. And so that means you should be fully compliant as early as late 2026 or early 2027. So the key takeaway is while implementation doesn't begin until probably 2026, you really need to start planning and budgeting now. The scope of these changes will consider significant preparation time. So these changes represent a fundamental restructuring on HIPAA works. It's not just incremental improvements. The shift from required versus addressable specifications to making all specifications required eliminates such flexibility that organizations have relied on in the past. So under the current rules, addressable specifications can be implemented as reasonable and appropriate for your organization. So, the new rules eliminate most of this discretion. This means that you can no longer conduct a risk assessment and decide that certain security measures aren't necessary for your organization. If it's in the rule, you must implement it unless you meet very specific and limited exceptions. So the documentation requirements represent another major shift. Current rules allow for general documentation of policies and procedures, but the new rules then require written documentation for virtually everything. So every policy, every procedure, every security decision must be formally documented. And this isn't just about having policies in place. It's about having comprehensive written documentation that can demonstrate compliance during an audit. So OCR will expect to see details documentation of every security decision and implementation. The enhancement administrative safeguards represent some of the most significant operational changes that you're going to need to implement. So risk analysis, it requires now, the requirements require really specific components that have to be documented. So asset inventory isn't just knowing what you have. You need to have formal inventory management with specific details about each system that handles any ePHI. So threat identification requires formal threat modeling, not just general awareness of cybersecurity risks. Risk determination has to be documented with specific methodologies and quantitative or qualitative risk ratings. And whenever your environment changes, you have to have a formal change management process that will trigger inventory updates. So this compliance auditing, it requires mandates annual internal audits, specifically that focus on the security rule compliance. This isn't going to be your general IT audit. It's got to be a comprehensive review, really, of every security rule and requirement within the documented findings and corrective actions. So these requirements, they represent a shift from informal security management to really a more detailed, formal, documented, auditable process. And if you don't have these capabilities, you're going to have to develop them or partner with organizations that do. The technical safeguards that represent the most concrete and potentially expensive changes you face is the multi-factor authentication that becomes mandatory for access to all systems that house ePHI. It's not just administrative access, it's for any user that accesses that ePHI in any form. This will require significant infrastructure investment in user training. If you're familiar with some of the large hospitals here in the Cleveland area, we have Cleveland Clinic and University hospitals. If you've noticed, really over the past 2 years, they've gone to the system where any medical professional that comes in will badge in and out of the computer with their ID. And so this is one of the forms of multi-factor authentication that happens. And we still see multiple healthcare organizations that have shared logins on computers. And these are concerns because even in the current systems that are requirements, those are not HIPAA approved. And so these are things that should have been addressed years ago, but it's going to be more enforced with these new audits. They have encryption requirements that mandate that ePHI must be encrypted both at rest and in transit. So at rest means when it's sitting there on the computer, on the server, and transit means if you're transmitting it to the cloud, if it's going between any type of partner organization, et cetera. So current rules allow encryption as an addressable specification, but the new rules make it mandatory with very limited exceptions. So this may require replacing systems that don't support encryption or implementing encryption solutions across your entire infrastructure. System configuration controls require mandatory deployment of anti-malware protection, and most organizations probably already have this, but the requirement for formal configuration management or regular updates becomes mandatory rather than recommended. And vulnerability management mandates regular vulnerability scanning and annual penetration testing. This requires either developing internal capabilities or contracting, again, with qualified security firms. This is one of the things that we can do. We can do both the internal vulnerability scanning and external pen testing. The unique user identification requirement prohibits shared login credentials. And again, this is not new. This is something that is in the current HIPAA requirements. That means every user must have an individual login credentials, and shared accounts are prohibited. And this may require significant changes as well to clinical workflows that currently rely on these shared station logins. So each of these requirements has both an initial implementation cost and ongoing operational costs that you need to make sure you budget for. The enhanced contingency planning requirement reflect the lessons basically that are learned from major breaches like the Change Healthcare. Criticality analysis requires you to formally assess and document which systems are most critical to patient care and business operations. This drives prioritization for both security investments and recovery planning. Response plans have to be documented and tested, and these new rules require formal incident response plans that are regularly tested and updated. This just doesn't means you can't just have a documented plan on paper. You've got to demonstrate that that plan works through regular testing. So one of the ways we help our clients is we'll do regular tabletop exercises. So a tabletop exercise in cybersecurity recovery planning is a simulated discussion-based activity where we bring the key stakeholders in, so like IT, security, leadership teams, and we walk through hypothetical cyber incident scenarios, such as a ransomware attack or a data breach. So the goal is to test and evaluate your organization's incident response and recovery plans that have been documented, but then identify any gaps in communication, decision-making, and technical processes. Then through those gaps, we can improve coordination between departments before a real incident occurs. And they're low stress exercises. There's no tech simulations. It's basically just like running a guided meeting, not a live drill where we actually change servers and things like this. But the rapid recovery requirement mandates a system and data restoration within 72 hours. And that is a significant change from the current rules and may require substantial investments in backup systems, redundant infrastructure, and disaster recovery capabilities. We saw last year the city of Cleveland was hit with ransomware and their systems were down for 10 days, which exceeded the 72-hour requirement. Cuyahoga County court system earlier this year was down for 2 weeks. Again, it exceeds the 72-hour requirement. And so you've got to understand 72 hours is a very short timeline to make sure your systems and data are back up and running and you can operate again. Also, there's a 24-hour notification requirement. And this talks about you must notify the designated stakeholders within 24 hours, both internally and externally, of a planned activation. So this requires the formal communication protocols and 24/7 contact capabilities. These requirements recognize that today's threat environment is not a matter of if you'll face a significant incident, but more than likely when. The new rule requires that you prepared for rapid response, and recovery. Let me grab a drink real quick. So the enhanced business associate requirements address the supply chain vulnerability that we've seen in these major breaches. Current requirements establish basic compliant obligations, but the enhanced requirements significantly expand those obligations. Annual technical safeguard verifications mean business associates must formally verify and document their security controls, and this has to be done annually. There isn't self-certification. It has to be a formal assessment and documentation. The 24-hour contingency plan activation notice requires business associates to notify covered entities immediately when they activate incident response plans. So this actually allows covered entities to activate their own response procedures when someone in their supply chain has an incident. Expanded subcontractor responsibilities also then mean that business associates are now responsible for ensuring their subcontractors, any of their vendors meet the same enhanced requirements. And it creates really a cascade of compliance requirements down the full supply chain. Detailed security documentation requirements mean business associates must maintain comprehensive documentation of all security measures and make this available for review by their covered entities. For covered entities, this means you're going to need to update all business associate agreements and implement a formal oversight process. For business associates, this means significant new compliance obligations and costs. This is, again, why we want you to be aware that these things are coming. So while our focus today was on the security rule changes, it's important to understand kind of the broader regulatory context. So, for example, the reproductive health privacy rule went into effect June 25th of last year, 2024, with compliance required by December 23rd of 2024. However, in June 2025 of this year, it was vacated by a court because it created significant uncertainty about privacy requirements. So the U.S. District Court for Northern District of Texas ruled that in crafting the reproductive health privacy rule, the Department of Health and Human Services overstepped its authority under HIPAA. So the court had held that the agency had no clear congressional mandate to create special protections for reproductive related medical data, particularly on politically charged matters like abortion, gender affirming care. So this invocation of the major questions doctrine required explicit legislation and authorization that was absent. The regulatory uncertainty then is exactly why you need to stay closely engaged with regulatory development and consider submitting comments on proposed rules during that window of opportunity they had between December of last year and March of this year. The pending privacy rule modernization from 2020 includes proposed changes that would enhance patient access rights. It's going to reduce care coordination barriers and may include specific telehealth provisions. So these privacy rule changes will interact with the security rule changes in ways that, until they're published, aren't going to be fully clear. But it's another reason, again, why early planning and preparations are essential so you're ready for these. So now let's translate these requirements into practical implementation strategy. Immediate actions for 2025 focus on understanding preparation. You need to review the proposed security rule in detail and conduct a comprehensive gap analysis in your current capabilities. You also need to look at things that what are their current rules there, not just the proposed rules. Are you using shared logins and that are not allowed even in today's HIPAA requirements? If so, those need to be addressed. And this gap analysis will drive your budget and implementation planning. The preparation phase from this year in 2025 to next year in 2026 focuses on policy development and technical implementation. You're going to need to update your policies and procedures to reflect what these new requirements are, and then begin implementing technical safeguards like multi-factor authentication and encryption. Compliance readiness, it requires resource allocation, staff training. The scope of these changes will require additional staffing, whether internal or contracted, and comprehensive training for all staff involved in EPHI handling will be required. The key to successful implementation is obviously starting early and planning comprehensively. You don't want to have this be a knee-jerk reaction and have a matter of weeks to implement it, because it's going to be impossible to do that. Organizations that wait until the final rule is published will find themselves rushing to implement complex technical and administrative changes and may not have the budget planned for these types of things. So please be aware of them and plan accordingly. So here are the immediate priority actions that we've come up with. And these should be started, we say, really within the next month or two. So first, conduct a comprehensive security rule gap analysis. And what that means is going over every current capability against every proposed requirement and identify what any specific gaps that are there. So this analysis will drive all subsequent planning and budgeting decisions. But second, you need to enhance your current risk analysis documentation. So even under current rules that exist, this is often where organizations fails audits. Start developing more robust documentation for asset inventory, network mapping, and vulnerability assessments. And again, anytime your network changes, you add new IT assets, all these documentation have to be updated. Third, implement multi-factor authentication if you haven't already, and this is going to be mandatory under the new rules. It's one of the most effective security controls that you can implement immediately. And we're not seeing this just across HIPAA, we're seeing this across PCI, we're seeing this across CJIS, and many different other compliance. So HIPAA is not the only one that's requiring this. It's very common to help make sure that your systems are protected. Fourth, review and strengthen your incident response procedures to meet these new 24-hour notification and 72-hour recovery requirements. And again, this could require significant changes in your current procedures and capabilities. And then lastly, eliminate shared logins immediately. And we talked about that on the last screen, but this is a requirement under the current HIPAA rules, but still unfortunately is often overlooked. Every user must have a unique login credentials, and the OCR will hit you hard on an audit if you fail this. So many of our clients have shared that requiring staff to log in and out of workstations each time they enter or leave is both time consuming and disruptive. Large healthcare systems like the Cleveland Clinic and University hospitals, they've streamlined that process using badge-based access systems. We mentioned that previously, and it's very quick. You just tap to log in, tap to log out. However, those enterprise level systems often come with onboarding costs of $20,000 or more. That doesn't include the hardware. That's just the fee for getting systems up and running. And that's a pricey tag for sure. And, that's kind of out of reach for many small to mid-sized healthcare providers. So one of the things that we've done is we have found similar solutions that we can deliver that functionality, but at a fraction of a cost, making efficient access control both practical and affordable while maintaining compliance. But each of these 5 actions provides immediate security benefits while also preparing you for new and current requirements. So here are some medium-term initiatives. Excuse me. These should be planned for implementation over the next 12 to 18 months. So technology asset inventory requires formal inventory management systems and processes. That goes beyond just knowing what systems you have to maintaining detailed records of all technology assets that are going to interact with ePHI. A vulnerability management program, this requires regular scanning, testing, and then remediation capabilities for any issues that are found. And it may require new tools, new staff, or new contracted services. One of the things that we did back in July of last year is, as we've seen new compliance requirements coming through across various things, including cyber liability policies, is we revamped our entire tool set to help make sure that we had solutions for whatever these requirements are. So business associates oversights require updating all agreements and implementing formal oversight processes. This includes regular assessments of business associate security capabilities and compliance audits. It's going to make sure that those business associates that you're partnering with have maybe NIST CSF compliance already there. Whatever you deem as a requirement there, you can make that a requirement for any business associates if they want to continue to be a partner vendor with you. And a compliance and audit framework requires developing internal audit capabilities that are specifically focused on ongoing security rule compliance. And that ensures that you maintain compliance over time rather than just achieving it initially. It's not a one and done. This is something that you get compliant and you have to maintain compliant, and it will be going on indefinitely. So these long-term changes represent fundamental shifts in how healthcare organizations approach cybersecurity. Increasing cybersecurity staffing will be necessary for most organizations. The complexity of new requirements that are going to require additional expertise, whether internal staff or contracted services with vendors such as ourselves. So budgeting for enhanced controls requires significant capital investment in technical controls, including encryption, network segmentation, monitoring tools, and backup systems. So strengthening security culture requires comprehensive training program and executive support. You've got to have buy-in all the way from the top. Security can no longer be just an IT responsibility. It must become an organizational priority with executive leadership and staff engagement at every single level. And ongoing compliance monitors requires continuous monitoring to ensure that sustained compliance happens. This isn't, again, a one and done. It's ongoing operational requirement. So partnering with qualified third-party providers may be the most practical approach for many organizations. The complexity of these requirements makes it difficult for small organizations to develop all necessary capabilities internally. The key point here is that these changes represent a fundamental shift. Again, we've talked about that on how the healthcare organizations have to approach cybersecurity and compliance. And one of the things we do here at Iler Networking Computing is we have a full team to make sure, as we offer compliance as a service, that they keep up to date, up to the minute on every single one of these compliance changes. And then we let our clients know about those as well. So let me conclude with specific resources and immediate next steps. Essential resources include the Federal Register NPRM, which you should download and review in detail. That's going to give you all the details, and you'll be prepared then for what the approved plan comes out to be. And then HHS and OCR guidance provides ongoing interpretation and clarification. NIST and HITRUST frameworks provide implementation guidance. HIMSS also resource offering ongoing education and network opportunities. And so when you download and review the NPRM in detail, don't rely on summaries, read the actual proposed rule text, conduct a comprehensive readiness assessment against your current capabilities, see how you stand out, because the majority of those will probably be implemented. And then engage security and compliance expertise, whether you hire someone internally or externally to support your implementation planning. Fourth, in the future, consider submitting public comments before the deadline. Again, this is your opportunity to influence the final rule. So as we mentioned, the deadline was March 7th of this year, so it's already passed. And then finally, begin budgeting for the 2026 implementation. The scope of these changes are going to require a financial investment for you. But the most important message I can leave you with is this: start now. You have plenty of time to do this, and planning ahead of time and spreading this out over months, especially 12 to 18 months, is going to be a lot better than doing this under 1 to 2 months when these, at the end, when the requirements actually come into play. All right, so embrace compliance, secure your future. And a lot of people will look down that this is, hey, law, we've got to go through all these hoops. But it's not just a legal requirement. It's really a strategic imperative for businesses to protect their assets, to maintain customer trust, and ensure long-term success. By implementing these right frameworks, you can mitigate risks, control your reputation. Just think, if you have a major data breach, how's that going to do to your customers? Are they going to continue to be your customers and your clients? And it's going to position you then for growth in the digital age. All right, this last slide that we have here, I'm going to open it up for questions and answers. So if you do have questions, please click on the question mark up above. You can enter the questions there. And I'm going to talk about the free offer there, and then I'm going to go through and answer these questions. So because this is such a huge issue, there are a lot of companies that just assume that they're doing well and their current IT provider, whether it's in-house or third party, is doing appropriate jobs. And so that's great if they are, but don't just assume. And so we are offering, for anyone that's attended this, a free network security analysis. So we will conduct a thorough vulnerability assessment of your network. If there are any critical security gaps, we're going to let you know what those are, and we can actually give you a prioritized remediation plan. This is at no, there's no obligation to stick with us. This is to let you know, basically let you sleep better. If we don't find anything, that's phenomenal, and you can rest assured that your current IT provider is doing the job they're supposed to be doing. But don't you want to know if you do have a security gap that could be used to make you one of these statistics? We want to help protect you from that type of thing. All right, so here's one of the questions that was posted. So what if the final rule is significantly different from the proposed rule? And that is a great question. Because again, we have the proposed rule that was submitted, but then they have all those public comments through there. So the final rule may include some modifications based on public comments, and we've seen this in the past. but the core requirements that we're seeing around MFA, the multi-factor authentication, encryption, risk analysis, and vulnerability management are unlikely to change significantly. We're also seeing this across multiple compliance areas. Like I said, PCI and CJIS have these as well. So the regulatory momentum behind these changes is driven by the current threat environment, and it just is going to continue to get worse. All right, another question. Let me read this. How much will implementation cost? That's obviously an important question. Unfortunately, depending on the size of your business, what your systems are that you use, costs are going to vary significantly based on current capabilities as well, where you are, and again, the size of your organization. But organizations should really budget for substantial technology investments, additional staffing, and ongoing operational costs. Again, you need to have dedicated staff internally or hire someone that can do compliance as a service to make sure they're keeping up with the changes. Having someone that is going to sort of keep up with compliance, but also have other rules inside does not work well. And the cost of compliance will likely be less than the cost of a major breach and regulatory penalties. And you saw those can really quickly escalate up into millions of dollars. Okay, we've got a couple more questions here. Can smaller organizations realistically expect to meet these requirements? And again, an excellent question. We have several smaller organizations that we afford and support. And again, a lot of them could not afford a $20,000 implementation for the same type of MFA that Cleveland Clinic and University Hospitals has already implemented. But because of that, we have searched out other vendors, and we have other partners that we have come in and become partnered with, that we can have created a scalable solution for the smaller organizations. So the key in making this successful, though, is early planning and potentially partnering with a company such as us to help understand what the budget is, and then you can plan for that for 2026. All right, what happens if we can't meet the compliance deadline? Oh man, that's a scary question, because traditionally OCR has been somewhat flexible with implementation timelines. If you show that you are demonstrating good faith efforts, meaning you're aware of these compliance changes, you have a plan in place, and have even a kind of like milestones of where you want to get and when you want to get there, they will look at that as you are doing what you can to implement it. Given the current enforcement environment, though, organizations should plan to meet the deadline rather than rely on good grace by the OCR or potential extensions. All right, and one last question we've got here, and then we'll wrap up. How do these changes affect business associate agreements? So really, all business associate agreements are going to have to be updated to reflect the new requirements that are published. Again, we should see that in Q4 of this year. So those things would include enhanced security documentation, notification requirements, expanded subcontractor obligations. Organizations, really, if you start planning this process as early, it can require extensive negotiation. And you could have business associates that are not aware of what these are. So again, having those conversations early with your business associates, it's going to just help the process go much smoother. So, well, thank you so much for attending today. I am not seeing any other questions. And so again, if you take a look here, there's a QR code for that free analysis. You can also go to our website, iler.com/analysis. If you have any questions, our email address and phone number are both listed there, info@iler.com, or you can reach us at 877-250-4537. Again, we've got multiple locations across the country, but we have companies that we help support all over the United States and even in Canada and Belize. So multiple countries as well. So even if you're not close to us, we can help 90% remotely. And we do have a great network of partners that we can help you with that will be able to do boots on the ground if necessary. One thing I want to let you know about is we do have another set of 4 more sessions coming up. And these are going to be webinars like this, but focusing and doing deep dives on specific topics. To see what those are and to register, you can go to events.iler.com. That's events.iler.com. Our next one's going to be on August 28th. which is dealing with PCI compliance. And again, positive securely. We want to make sure that you're aware of what the new PCI requirements were for your business and that you're protected. So any organization that takes credit cards, again, there are a lot of healthcare organizations that have to follow HIPAA compliance and PCI compliance. Fortunately, there's overlap in there. And so you get compliant with one, you're going to be partway to being compliant with the other. September 11th, we're going to be doing NIST CSF and CIS. So if you're in Ohio or another state that offers safe harbor for any organization for that, I highly recommend you join this. This is something that is public information. You can go to NIST CSF and download what all those requirements are. And it shows what you have to do in order to become compliant. On September 18th, we're going to go over FTC fines that are tied to the FTC safeguards rule that came out last year. And so we want to make sure that if you are a CPA, basically if you deal with client finances, it's not just banks, but CPAs, accountants, financial advisors, if automobile dealerships that deal with car loans, universities and colleges that deal with student loans, et cetera, all these organizations have been having or should have been FTC safeguard compliant back in for well over a year now. And there's significant fines and fees, including jail time if you're aware of these and have chosen not to become compliant. So we want to walk through that. And again, that's going to be September 18th. And then our last one will be October 9th. And that's going to be Justice League level security. We're going to dive into the new CJIS compliance for our real heroes. So again, all these are listed on our website. Go to iler.com and click on the events section there, or you can go to events.iler.com. And if any of those apply to you or you're just interested in those information, we hope to see you there. Otherwise, have a great rest of your day. Stay safe, and we'll talk to you soon.